Mr. Secretary, it's great to see you. Thank you so much for being with us, and a special thank you for coming down to Hampton Roads, home to a lot of Navy veterans, a lot of military veterans, so I really appreciate your time, not just visiting my district, but so many. You've been doing such an amazing job, and you're starting to sound like a broken record, which I guess is good, but over and over again about how we are not cutting staff and how you're looking out for physicians and nurses and allied health partners, and I think that's important just to repeat that, and we'll try to repeat that as well on your behalf. I know that one of the VA's statutory missions is training for health professionals, and that includes nurses. And we have a nursing shortage right now across the board, not just in the VA, but on the civilian sector. So I'm thankful for the VA's investment in educational opportunities, including residency programs and clinical opportunities. And you have 68 nurse residency or clinical programs, including 34 primary care slots, 26 mental health slots, and you've expanded that to 8 geriatric and extended care slots. And as a geriatric nurse practitioner, I'm certainly thankful for that. I think that we have a lot of older veterans, and I know that with the aging of America just in general, we need to be focused more on providing geriatric-specific health care. So thank you for recognizing that. I wanted to offer some comments on behalf of what I consider to be an underutilized resource. It's no secret that sometimes physicians feel encroached upon when we integrate advanced practice nurses, but their superb care cannot be overlooked. And I think we've talked about that even a little bit today. But just to present some evidence-based research, I know that patient safety outcomes are identical regardless of whether, for example, anesthesia is provided by a physician or a CRNA. There's no secret that we have a shortage of anesthesiologists, so we have nurse anesthetists who are available, and there's a lot of debate about integrating them into VA healthcare. CRNAs are often the sole anesthesia provider in rural hospitals, ensuring safe obstetric outcomes. And then we've got 31 facilities in the last VA OIG report that cited a severe shortage of physician anesthesiologists, including my Hampton VA Medical Center. The Trump administration has consistently supported the removal of barriers for CRNAs and other advanced practice RNs. During the pandemic, the administration went even further, suspending Medicare supervision requirement for CRNAs to allow them to practice to their full training to provide critical care when the nation needed it the most. At the same time, the VHA put out a memo calling for facilities to remove restrictions on CRNAs. These recommendations are also supported by the National Academies of Sciences, Engineering, and Medicine. Calls to remove restrictions on CRNAs are well supported by data. So I would love some clarification on what your plans are as the new VA secretary to integrate advanced practice nurses especially. We have this lack of anesthesiologists. We have a group of people that can provide that care. So just would love to hear from you what your plans for integration are.
Thank you, Congresswoman. I appreciate it, and I've enjoyed working with you and also working with opening facilities. I think it was really interesting that one of the issues that we had to deal with early on was in actually your district, in which there was a discussion about opening a facility, and was said because of hiring freezes and everything else, it wasn't opening as it should. And the reality was it was opening just as all the other CBOCs have opened, and that is with a gradual rollout. So I appreciate your work there. We're looking at our scope of practice issues on many fronts. This was a project that was begun a lot before me, a couple of secretaries ago. We're still continuing to look at that. As you've heard even today on this, there's a lot of disagreement, especially when it comes to certain areas. And so we're trying to find what is the best balance, not only for VA, but also for our employees as well. So we're still looking at that issue, and we'll be getting more input as we go forward.
We'd love to work with you on that as one of 2 nurse practitioners here in Congress. We feel critical healthcare shortages and gaps where I think our care is valued, and I know that the VA is always on the forefront of wanting to provide the best patient care, so just please don't overlook advanced practice nurses and the role that we play. And then just to switch gears from healthcare a little bit, I know we've talked a lot about healthcare and VA medical centers, but there's a lot of other veteran benefits that you will oversee now, including GI Bill benefits and even healthcare, but VA home loans. What exactly veterans are entitled to. And I know as a veteran with a veteran family, it's been frustrating sometimes to actually access my benefits and to understand what that looks like. And you and I spoke at a roundtable briefly just about what that online component looks like. For example, MilConnect doesn't talk to the VA website, and I feel like there's some technology challenges there. It creates a lot of frustration on the part of veterans. And when I share with my veteran friends, how hard is it for you to access your GI Bill benefits or to transfer those to your children? all of us share the same level of frustration. So with our VA budget that we have, can we, or do you have any plans to dedicate a portion of that into upgrading this probably outdated technology? I think that that investment of trying to make it a little more user-friendly, that website piece, so veterans can log on in one place, can see their benefits, can understand, how to transfer their GI Bill benefits to their kids, what even that paper trail looks like. I got a 15-page letter about my son's, it was my husband's GI Bill benefit, but transferred to my son, and that I couldn't really decipher. And so that was frustrating to me, and I'm sure I'm not alone. So just would love to hear your plans about that technology upgrade, and if you could add that to your list of things to do to maybe make that website just a little more user-friendly.
Yes, Congresswoman, we're looking at every opportunity we can to streamline our online access, our online portals to make it easier to understand. It goes back to something in your comment just now reminded me that when I actually was able to access my benefit, when I used it transferred it to my kids, was I didn't even know it existed. And it came to me when I was on base one day, and I had another officer who we were just talking about it in general, and he said, well, you know that you can use that money? I said, what are you talking about? Again, this just shows you that there's an understanding that needs to happen even more as we go forward. So yes, anything we can do in that realm, we're going to continue to do. It's about this is probably as clear as I can say, it's about putting that veteran first and saying, how can we make that happen for all of our veterans and make it easier? I've said this earlier this morning, I'll say it again, and I may have partially said it here. When a veteran has to call any one of your offices, and 60% of your caseload is VA caseload, when they have to call your office, it's a mission fail for us. It's a mission fail for VA. It should not be this hard to get benefits that are already earned, no matter what the bureaucracy says or anything else.
Thank you for that. All those benefits are important health care, but even the education benefits, et cetera, et cetera. So thank you for prioritizing that as well. I appreciate your time. I yield back.